At the end of this episode, 4 people across the nation will have been diagnosed with Alzheimer's disease, according to a report by the Alzheimer's Association. Many of these people live alone and have to fend for themselves. There is a new pilot program that may change the way Alzheimer's patients are cared for in the future. Easter Seals of South Florida was one of 5 locations in the country to try this new person-centered care. Here to explain the program and its benefits is Vice President of Programs, Angela Aracena, and thanks very much for joining us. How does this program differ from previous programs?
Traditionally, professionals decide what they think is best for people with Alzheimer's and for their families. We plan, we design, and we decide what the goals are. Well, let's turn it around. Let's have people with Alzheimer's and their family decide how they want to design the program. What is it that really is their ultimate goal, but it's their personal goal. For example, you have a ship that is being captained now by the person with Alzheimer's. They had interests, they had preferences, they had a life history. So we want them to incorporate this type of interest and preferences and everything designing into the program. The person with Alzheimer's should be the one that decides what they want.
I guess the stereotype is when you have Alzheimer's, you just go away. You're not really in there anymore. But what you're saying is that people really deserve personalized care because it's not universal.
Because they're a person. They are still a person. You don't lose that personhood because you have Alzheimer's or because you're older, because you have gray hair. You continue to have a person. You are a person with history, with preferences, with interest. You want that to be validated in any program that you participate in. You are a participant. You're not just an object that receives care.
The programs that were in place before, where were they lacking?
They were lacking that person-centered. We plan activities because we think it's the best for the person with Alzheimer's, because we want them to be interested in this new program. But that's not the way it should work. It should work that we create activities that they are already interested, that reflects their life history. For example, you go into an adult day care center that should reflect someone who was there, who used to play the piano, who can continue to play the piano, or who can listen to the piano, someone who liked to watch birds or grow orchids. The activities should be surrounded and reflecting the people that are in there.
And when an individual contracts Alzheimer's, different phases, right? You have people who have very lightly and some people who have it very intensely.
Right. When a person is in the early stage, they can vocalize what their interests are. But even when they're in the advanced stages, we can know what those interests were through the families. The family is an integral part of the program too. They can relate to the professionals what were the things that this person was interested in before and what were their preferences.
Numbers are growing of Alzheimer's patients
Absolutely.
that need to be taken care of in the future, right?
Absolutely. As the baby boomers grow old and they retire, the numbers are going to grow. It's not the percentage of people with Alzheimer's that's growing, it's the exact numbers of the total numbers of people with Alzheimer's that is growing.
Okay, well, thank you very much. And I hope you have much success with this care. Thank you very much. This hour's newsmaker has been Angela Aracena discussing a new pilot program for Alzheimer's patient care. I'm Spiro Kent for Comcast Newsmakers. We thank you for joining us.